In the city of Lagos, there is a social contract between the people and the government to deliver the proverbial dividends of democracy. Obviously, Lagos is working. Lagos is progressing. For the City of Lagos TV show, we are committed to bringing you the developments as they unfold in the city. Thanks for joining us. Welcome to the City of Lagos TV show today. And of course, we're going to be bringing you the sight and sound of the recently held first Lagos State Health Insurance Summit, which of course was put together by the Lagos State Health Management Agency, Lashma, with the theme, Accelerating Social Health Insurance Coverage in Lagos State. It was indeed an event that brought together experts to take a look at strategic-driven methods to ensure that Lagosians and of course quite a number of other people are fortunate to be part of the health insurance scheme. The historic event also saw the official launch of the Ilera Eco virtual booth as an initiative to bring healthcare delivery to the doorstep of Lagosians. In a chat with the City of Lagos TV show crew, the Permanent Secretary of Lashma, Dr. Emanuela Zamba, explained the rationale behind the theme of the event and the launch of the virtual booth, with the assurance that with the health insurance scheme, Lagosians are in for a good deal.
We have been doing social health insurance in Lagos State based on the Lagos State Health Scheme law. However, when the federal law came out in 2022, which now says that social health insurance is now mandatory across all the states, we feel that it is something that we need to, latch onto and ensure that it will help us to expand coverage in Lagos State. So we're here to have various people and opinions, perspectives, etc., from all the guests here, play in the health insurance space to give their perspectives to these issues. We'll all look at and examine the issues that are in that law and find out a way that we can implement that in Lagos State to the benefit of all Lagos residents and to advance universal health coverage in our dear states. When you say something is mandatory, it behoves on you to be able to provide access to people. In terms of distribution of health facilities across the states, we are not in every single nook and cranny. And if the health insurance is going to grow, if people make some kind of payment, there should be somewhere that they can access care. So we are going to emphasize areas where there is a dearth of facilities, place these virtual booths in there. If you are an enrollee, you can walk into that facility. You can have a virtual consultation with a telemedicine provider who will now prescribe drugs for you. You can go to the nearest community pharmacist, pick up your drugs. And if you need to go for in-facility care, you will be referred to the in-facility care of your choice. That is, you have picked that facility yourself when you came onto the scheme and continue your treatment. It's just to improve and deepen access for people. So we have partnered with Sterling Bank, who is very big in the health space, to provide at least 300 of these booths across Lagos. They will be deployed in phases. We will pick the areas very strategically and selectively, as I said, to augment, not replace, but to augment or complement what is already existing on ground in the state and move that forward. This virtual booth is to ensure that, because I know that some of us do not like to go and wait in hospitals. If you know that what is wrong with you is something that's minor, is mild, you can just walk into the booth anywhere, just be around the corner from you and get access to care virtually. It's the same thing, but it is an improvement on waiting time. It makes ease of access to care much, much better for you. So please, key into the virtual booth. You'll be seeing it very soon in your neighborhood. Collaborate and join us.
The Lagos State Governor, Mr. Babajide Sanwo-Olu, represented by the Permanent Secretary of the Lagos State Ministry of Health, Dr. Olusegun Ogboye, in his speech, did not only emphasize the enormous diverse potentials and benefits of the scheme to Lagosians, but the governor equally highlighted key fundamental initiatives of his administration to offer and provide quality healthcare delivery to the citizenry in Lagos State.
Let me start by congratulating the board and management of the Lagos State Health Management Agency for conceiving and putting together the Lagos State Health Insurance Summit, the very first at the sub-national level in the country. At the inception of this administration, we made a commitment to improve the quality of life of our people and steer the state towards universal health coverage, where Lagosians will have access to the health services they need, when and where they need them, without financial hardship. These services include a full range of essential health services, from health promotion to prevention, treatment, rehabilitation, and palliative care. This is one of the major goals of the health and environment pillar of the Things Plus agenda, with the plus representing the incorporation of an intensified focus on social inclusion, gender equality, and youth development in these next 4 years. To bring this promise to reality, we wrote on the existing LSHS law, which makes it mandatory for all residents of Lagos State to possess a health plan in order to have access to quality healthcare services, thereby reducing out-of-pocket expenses on health and ameliorating the financial hardship caused by payment of huge medical bills.
During the panel discussion at the event, some of the panelists equally identified key areas of concern that requires adequate attention to make the scheme a success.
I just want to ask the audience one question. How many of us visited the primary health center this year? The primary health center in Lagos State for a medical service, not for inspection. For medical service. So the domestication starts from you, because all the noise you have been making on this while about putting money into health sector is 80% to revive our primary health centers. And we are now saying it's now compulsory for every Nigerian to contribute towards the health insurance. We need to make the people have some confidence in our primary health centers, to make them pay happily, that when they contribute, they can go to our primary health centers and have a service. And it's people like you that can help the government to complain about the situation we find in these primary health centers. When you have a headache, you either go to teaching hospitals or you go to secondary hospitals, which is a misnomer. We are complaining about funding. National Health Insurance Act, Insurance Authority Act now has made it compulsory for every Nigerian to contribute. So after we get all this money, we need the state government now to make the primary health centers inviting for all Lagosians. So that is the first aspect that is very important for us to ensure that this domestication is going to work.
About 90% of the interventions you need to achieve universal health coverage can be provided by the primary healthcare system. I'm talking about PPM. Let's remember that even private facility can provide primary healthcare, either directly or in conjunction with the public sector like Dr. Ajayi has spoken to. So we must fix our primary healthcare system in order to achieve universal health coverage. And the fourth is financial protection. People must not be pushed into poverty while they are trying to seek healthcare.
The City of Lagos TV show will continue in a moment. Keeping Lagosians abreast with developments across the city of Lagos is our prerogative every week. Join us again next week as we tell you the story of our Lagos, your city, my city on the show. Keep loving Lagos.